Hello, my name is Mercedes, and today I will be discussing leukemia. So, what is leukemia? Leukemia is a type of blood cancer that starts in the bone marrow, inside the spongy bone, where blood cells are produced. It is known for creating an abnormal production and accumulation of white blood cells. It develops when blood forming cells in the bone marrow undergo mutations, which causes an abnormal production of white blood cells. This disrupts normal function of the red blood cells and the platelets. Leukemia was first discovered well over 200 years ago by several different scientists, including Peter Cullen, who described it as having a milky blood texture, and Alfred Velpeau, who identified and helped to describe leukemia symptoms from a patient and observed pus in the blood vessels, as well as a whole host of other scientists who began to decipher and identify the causes and properties of leukemia. Most commonly in patients that are above 60 years old, adults who are 60 years older and older. Each cell type has a different function. White blood cells fight infection. Red blood cells deliver oxygen from the lungs to the tissues and organs. Platelets help form clots to stop bleeding. Leukemia occurs when there's a mutation in the DNA of the bone marrow, which produces malformed cells. There are four types of leukemia: acute lymphocytic leukemia, acute myeloid leukemia, chronic lymphocytic leukemia, and chronic myeloid leukemia. There are several ways that a person and or patient can be susceptible to getting leukemia: through genetic risk factors such as inherited predispositions in the case of Down syndrome and Fanconi anemia. These increase the risk of leukemia. Another reason is dominant inheritance, such as CEPBA, RUNX1, and GATA2 genes. These makes a person more susceptible to getting leukemia due to dominant inheritance, as well as chromosomal abnormalities. When a translocation between chromosome 9 and 22 happens, the gene fuses to form BCR-ABL1. This chromosomal abnormality makes a person more susceptible to having leukemia. There have been 66,890 new cases of leukemia and this year alone, which makes up about 3.3% of the overall types of cancer. And there are an estimated deaths of 23,540 this year alone from people who have leukemia, which makes up about 3.8% of total deaths. People who are diagnosed with leukemia have approximately a 5-year relative survival rate, which is approximately 67.8%. Again, leukemia is most common among older adults that are 60 to 65 and above. According to a study that was done, North America and the United Kingdom had the highest prevalence when it compared to other countries for having leukemia. 43.15 per 100,000 persons in US, and it was a similar amount to that in the United Kingdom. Compared to its Asian counterparts of 20 per 100,000 people, and that compared to its African counterparts of 8.49 per 100,000 people, which had the lower total, lower amount, which I thought was very interesting. Here we see that leukemia causes all types of symptoms. Now, it mainly affects the bone marrow, blood, and lymphatic system, but it can also affect organs such as the spleen, liver, and the central nervous system, as well as testicles and males. Symptoms of leukemia include shortness of breath in the lungs, tiny red spots on the skin, pain and tenderness in the bone and joints, muscle aches, liver and spleen pain, swelling, lymph node swelling, and chronic fatigue, weakness, and low energy. When a person has leukemia, they typically experience frequent weight loss, fevers, and frequent infections, all because of this condition of having, as we can see here, the malformed white blood cells on the right for a person that has leukemia has fewer red blood cells and fewer platelets. This shows that if a person has fewer red blood cells, that means that there's fewer cells to carry oxygen throughout the body. And the white blood cells that are being produced are immature and they're malformed. All of this is due to the altered stem cell, which is deformed as well. And this all leads to a person having all of these aches and different pains and conditions in the body. As far as the physiology goes and the symptoms, leukemia disrupts the normal physiology by overcrowding the healthy red blood cells with a large amount of white blood cells in the bone marrow. This in turn affects organ function as well as other surrounding organisms and increases the risk of infections such as anemia and bleeding. Anemia occurs due to the decrease in red blood cells, which reduces oxygen in the blood, heart, brain, and muscles. The heart, due to a combination of anemia and blood clots, can cause heart failure for a person that has leukemia. Leukemia cells in the brain can cause seizures, headaches, and other neurological problems. Kidney damage can also occur due to the accumulation of leukemia cells in the kidneys. Also, there are several types of lung issues and breathing issues a patient may have due to the accumulation of white blood cells in the pulmonary area due to the malformed cells. If a patient has leukemia and is left untreated, it's very life-threatening. It can cause anemia, infections, uncontrolled bleeding, and organ damage, and ultimately untimely death. As far as the physiology goes, it can affect the abnormal blood cell production, disrupted cell function, suppression of healthy blood cell production, and volume control. All of these are different ways in which leukemia affects the physiology of the body. Again, as far as the symptoms go, night sweats, fevers, fatigue, swollen lymph nodes, frequent or severe infections, enlarged liver and spleen, excessive or easy bruising, unexplained weight loss. These are all a whole host of effects of leukemia on the body. In order to diagnose a patient, typically there are several different ways in which that's done. Bone marrow aspiration and biopsy, lumbar puncture, flow cytometry, complete blood count peripheral smear, immunochemistry, and cytogenics. As far as treatment is concerned, it depends on the type of leukemia and at which stage the patient is at. Treatment is usually including chemotherapy, which consists of killing fast-growing cells, including aggressive cancer cells, targeting therapy, which seeks out the leukemic cells, stem cell transplants, which helps to stimulate production of healthy cells in the bone marrow, radiation therapy to help kill cancer cells that have settled in organs such as the liver and spleen, and immunotherapy to help the immune system recognize and attack cancer cells. These are all ways that are designed to help a patient to combat leukemia. As far as a cure, I wasn't able to find anything that said it had a specific cure for leukemia, but that they do have medications and use these different treatment options to help a person to cope and have a better quality of life. Again, the survival rate is 67% for a person to have a 5-year survival rate is about 67%. So overall, leukemia is a disease that is still extremely prevalent from young to old. And currently, as far as I'm able to tell by my research, does not have a cure. Thank you.